topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
And we are back. I want to welcome our national audience who's joining us now for our Dallas-Fort Worth show. We have been doing this show for 15 years now, and I must say that there is a topic that I've never seen become as popular as it is, and I understand the reason why. Chiropractic care. And I got to tell you, I've seen over the years what chiropractors are doing now versus, say, 10 or 15 years ago. And I think one of the greatest things about a chiropractor is that they can literally save you from having to do surgery. There's so many different areas that they cover. And we're lucky enough. We've got the functional health centers located in Dallas, Texas. And let's welcome Dr. Adam Boneblust.
Hey, great to be here.
Hi, Adam.
How's it going?
Well, you know what? My family all tells me how cold it is there in Dallas.
It's very, very cold for us, yes.
Wow. Did you get any snow?
No, not this time, luckily.
Yes. Well, hey, Adam, I was just telling everybody that I can't believe how far your profession has come. And the things that you're doing that, listen, from a guy who had 2 knee surgeries, replacements, I wish I'd have gone to a chiropractor first.
For sure.
Tell people, first of all, about your practice.
We're primarily a chiropractic practice. We focus on really optimizing health. So not just a simple neck or back pain, but more in depth about the issues. So the muscles, the connective tissues, the gut health, the immune system, the healing response. So we try to be an encompassing practice that helps anybody with any kind of musculoskeletal conditions, nervous system conditions, even gut health issues.
And, you know, I'm hearing that you all are even, I know you work with auto accident injuries, which we have a personal injury attorney who talks on auto accidents. But what are some of the most common types of personal injuries that you see at your clinic?
First and foremost, it would be the whiplash type injuries. So people are in small to medium car accidents where there's mild to moderate damage to the vehicles. Even there's some research that came out of a couple of different schools that tells us somewhere between 8 and 15 miles an hour in a car accident is enough to cause permanent damage to your neck and your lower back. So we see those mild soft tissue injuries. Sometimes we do see the moderate to severes where we have disc herniations, broken bones, broken ribs, those kinds of things, mild traumatic brain injuries. But the most common ones are going to be those mild soft tissue injuries. And the big problem with those, if you leave them untreated, they turn into osteoarthritis, degeneration, all those conditions you were talking about that end up in a surgical setting. So we want to address them before they get to be a problem.
We just got our first text. This is from Garland, Texas. I found your show by accident on iHeart last month, and I was so glad to see that you're back on again this month. I've got to ask, is there really a such thing as whiplash?
For sure. We can say that it's more of a generalized term for any injury that happens where the head goes forwards and backwards quickly, right? So it doesn't have to be a car accident. It can be a slip and fall. It can be getting hit in the head. Sports injuries are very common that we have some whiplash in conjunction with things like concussions and stuff like that. Essentially, we're defining the injury to the soft tissue that connects the bones together in the neck. It can be a muscle, it can be a tendon, it can be a ligament, it can be the disc. But that whiplash injury is going to affect many of those components of the soft tissue. And it's just going beyond the limits of those soft tissues in a very small amount of time. That's where we'll have those injuries that we generalize as whiplash injury.
You know, this is really important. A lot of people will say, well, I was in an auto accident, I'm not hurt, or even a slip and fall. And they go, I'm not hurt, so it's silly to go see a doctor. But sometimes those injuries don't really appear for 2 or 3 days or even a week. Is that correct?
For sure. Yeah. Just simply the inflammation cascade sometimes takes up to 72 hours to see its peak, right? So we may not feel much discomfort the day of, the day after. That third day, you're really sore and achy. That sore and achiness is your body's response. It's trying to heal some kind of damage to the soft tissues. Even if we just feel a little bit sore and achy, it could be evidence that we have some more severe injury to those soft tissues. I have many patients that show up 10, 15, 20 years after a minor car accident that had no treatment. I have severe osteoarthritis now, and they just didn't know where it came from. It was that minor, I didn't feel any pain, I didn't break any bones, it was nothing type accident. So better to get it checked out.
It's really important that a person, if they're in an auto accident, come to you, first of all, to make sure everything is okay. But, we just got a text here from Matt in Arlington. And he said, I had back surgery last year. I am in worse shape now than before the surgery. Adam, do you hear that often, that maybe they should have maybe come to you first rather than have that surgery right away?
Unfortunately, it's a very common thing. For some strange reason, we end up being the last port of call for a lot of patients. They did PT, they did injections, they did pain management, they did surgery, and now they're at their wit's end and they can't find any solution, and they show up here. And that really should have been the first place they went. Even if you end up having to have some kind of surgical intervention, having appropriate chiropractic care with the physical therapy and all the other components is going to increase the chances of that surgery being successful and your recovery being much better, right? So even if it ends up in that department, which I hope it doesn't, it's going to have a better outcome overall. So it really needs to be the first place you go.
And, if a person's in an auto accident, what are just some of the signs someone might look for to see if they need a chiropractic care?
Generally, if there's any kind of damage to a newer vehicle, that's more than enough indication that you need to at least get checked out to see if there's any kind of injury. If you're feeling any kind of soreness, achiness, people will describe it as a deep gnawing pain that they can't quite pinpoint. That's evidence of a ligament injury, which is a very severe thing that needs to be addressed quickly. So soreness, achiness, those gnawing, deep pains, something doesn't quite feel right, or you can't turn and don't have the normal range of motion anymore. Those are all really good indications that we do have a soft tissue injury that needs to be addressed.
I'm sure you've seen patients that blew off their injury thinking it would heal, get better. I don't have time. They waited too long. What happens if you do wait too long with some of these injuries?
So the ultimate thing is that you're going to have severe osteoarthritis. That's the breakdown of degeneration.
That's bad enough.
Tissues, yeah. It's really a very slow progressing disease. From the initial injury to generally we'd say a surgical intervention is going to take 20 or 25 years. But there are so many steps in between that we could have addressed it before we got to that point. Right? So making sure that we take care of it early is really the best option for us.
Adam, there's so many people who have never even been to a chiropractor, who are so uneducated about what you do. What are some of the things people should look for when they choose a chiropractor?
So anybody that has any kind of issue, so whether it be headaches, neck pain, low back pain, something like that, we want to find a chiropractor that focuses more on holistic treatment. So we want to have somebody that comes up with a decent plan, explains to you what's going on, right? So they want to take x-rays. They want to do an exam to figure out what parts or pieces are working and not working, and give you some kind of idea of what it's going to take to get it treated. So we really wanted a provider that's going to do all the necessary steps to come up with a good treatment plan that's going to be the most successful for you. If you have no issues and you just want to experience chiropractic, there's plenty of different wellness type chiropractors in which you just go, they make sure that nothing's wrong with you, and they can give you the experience of an adjustment or the chiropractic treatment so that you can at least know what it's like.
Helen in Plano, great show. I'm wondering, does your expert treat headaches, migraines, and if so, how do you treat them?
For sure. Those are some of my favorite cases to see the changes, right? It's so miserable to live with headaches and migraines. And if you always have these migraines, it's so debilitating. It encompasses every part of your life, right? So these are really special cases for me. A few weeks ago, I had a mother come in that she was at her wit's end. She couldn't operate. She couldn't help take care of her kids, couldn't help her house. She couldn't go to work anymore. And she was dealing with pretty consistent migraines. Almost every day she was having somewhere between 10 and 12 hours of a migraine. There's many different types of headaches and migraines. So when we think of treatment, there's variables.
What's the difference between a headache and a migraine?
Generally, a headache is going to be a isolated pain. So we're going to feel it in one spot or the other. It's not the whole head that feels like it's going to blow up, or that you have any kind of symptoms behind the eyes, or auras or changes in the vision. The migraines are really the whole head's killing you. You feel like your head's going to blow up. It affects your vision and your hearing sometimes. It's a much more severe headache for sure. But so many variables go into where these come from, what problems cause these types of issues. So the treatment's variable in that. Sometimes it is just making sure that the upper part of the neck, so where most of the nerves that you feel your head come from, is operating and moving the way that it's supposed to take the pressure off the nerves, the muscles, and the connective tissue. Some of it is the nerve input from the rest of your body being disconnected and causing those wiring within the brain to go haywire and cause us a lot of discomfort and pain. We do an assessment to make sure that we will be successful with your type of headache or migraine. In many cases, we can help those tremendously and even resolve them entirely.
Did we lose you?
Am I here?
Okay.
Right.
Our weather, believe it or not, is bad here. Not like yours, but it's bad. It's amazing. We get down to 50 degrees, Adam, and everybody's got the parkas out, So, it's amazing, though, that you can treat headaches. Oh, my God. I've known people that just light bothers their eyes. Mm-hmm. And it's so sad. What are some of the other areas that you like to treat?
Some of my favorites are going to be extremities. I really like helping people with shoulder problems, knee problems, hip problems. Those are really more soft tissue oriented. I have a lot of experience with myofascial release, a bunch of different techniques that are specific to the soft tissues and physical therapies that support it. I enjoy seeing the changes in those tremendously. It's a lot of fun for me. The rapid relief that I can give somebody makes me just feel warm inside. To give somebody an ankle that's working and they haven't been able to walk for 10 years, right? To make that happen for people is really rewarding for me.
Ron in Farmers Branch wants to know, do you do physical therapy at your clinic?
For sure. We do something like physical therapy. The physical therapists have that coined for theirs. So we would call it rehabilitation. It's active rehabilitation, much like you would do at a physical therapy office. We're having you neurologically connect with the muscle again, strengthen the muscle, coordinate all the muscles together. And so we do many different forms of physical therapy in order to get you the best results that works very, very well in congruency with the chiropractic adjustments. It's a wonderful support that makes a huge difference in the ultimate outcome for our patients.
This is Greenville Avenue. That's Dallas. Yeah. Really enjoying the show. I was one of the people who wrote you that you should have a chiropractor on your show. Does your expert do laser?
I do not have any of the class 4 lasers in the office. Many providers do have those types of things. There's a wonderful clinic down the street that specializes in a lot of the passive therapies. In my office, I tend to focus on the active therapies. So anything that's accessory like that, I do refer them to that provider too, and we work together to help those patients.
Adam, why do the insurance companies? I don't understand why they don't cover a lot of things that chiropractors do, because what you do, especially in the long term, I mean, to me, it seems like it would save them a lot of money.
There's been a lot of statistical analysis that's been done lately that, told even Blue Cross Blue Shield they'd save hundreds of millions of dollars a year if they used chiropractors as the first protocol for any kind of musculoskeletal issues. I think there's an unfortunate holdback to the 90s and the early 2000s where there was a lot of misinformation that was spread about chiropractic care, and the success rates. And it takes so long for the insurance industry to make changes to accommodate for those types of things. I think they're just behind the ball on that significantly.
Absolutely. Well, let's talk about the number one subject. And if you've ever had low back pain, you know how painful it is. And I used to have it where I couldn't even get out of bed, and it affects your breathing. How do you treat low back pain now?
Depends on where it's coming from, for sure. So there's many different reasons that we can have lower back pain. Generally, I say the majority of cases are going to be subluxation based. So we have soft tissue injury that caused one or more of the bones to become roughly out of alignment with the rest. That misalignment in the system causes more irritation, more degeneration of the soft tissues that connect to the bones. We get more inflammation, more scar tissue. Over time, that starts to build up and cause pressure and irritation to the nerves that surround it. And that's generally when we'll start getting the pain. So by the time you have low back pain, you've had a problem for years, typically. The treatment for that would be to make sure that we break down that scar tissue so that we can optimize or normalize the range of motion or movement, help rebuild the muscles and soft tissues in the surrounding areas to keep that range of motion and movement normal. And that's where we can really, truly find solutions for this, true correction to the problem.
Oh, this is a great question. Marie wants to know, I was in an auto accident. My attorney said I had to see a certain chiropractor. Do I have to go to that chiropractor, or could I make an appointment with you?
The legality of that situation, you do not have to see that particular chiropractor. Generally, if you've already hired the attorney, any chiropractor that accepts what's called a letter of protection, which your attorney can provide, would be able to take care of you. We take LOPs all the time. I'm happy to work with just about any attorney. There's a couple on my list, but most every attorney I'll work with. You don't have to go to any particular provider, and your attorney really shouldn't dictate that for you.
I totally agree. What does a chiropractic, how does a chiropractic care complement, say, other medical treatments, especially for personal injuries?
Sure. Most of the time, when we have enough soft tissue injury that it causes an inflammation cascade, that we have a tremendous amount of discomfort and pain, we're going to go to pain management. The pain management providers are going to give us some type of anti-inflammatory along with a corticosteroid and a muscle relaxer. So we're trying to reduce the overall inflammation so we have less pain, and a muscle relaxer. That's a great starting point. It gives us a little bit more comfort, range of motion, those kinds of things. And it gives me a really wide door to start getting a lot of work done. Right? So we can start getting a lot more movement. We can start getting a lot more stimulation of muscles, repair of those soft tissues. Patients that have head traumas or mild traumatic brain injuries do significantly see improvements in nervous system function with chiropractic care. It helps optimize the inputs and outputs so that the brain can normalize that normal function. Keep everything working the way that it's supposed to.
I know you do a lot of treatments for personal injury recovery. Are there also supplements and exercises they can also do?
For sure. There's many supplements that would help support the necessary inflammation. Right. So when we think of the inflammation cascade, it's something that has to happen. For example, say you're walking down the street and you roll your ankle, it's going to swell up. That's the immune system's response to damage. We need that inflammation process to occur in order for us to heal those soft tissues. Right? So taking things like ibuprofen, Aleve, Tylenol, they stop that process. They slow it down. So if we could find relief from things like supplements, we'd say magnesium or zinc or different things that would help reduce the inflammation naturally so that we can continue that healing process with less pain. I really like whole body collagens. That things to help a lot of people that had a fresh injury, have plenty of building blocks so that the body is really very efficient and effective at repairing those soft tissues.
What ways do you help your patients regain their strength after an injury?
The most important thing is that we help reconnect the nerves to those muscles. Anytime that there's an injury to a muscle, there's a neurological inhibition. The brain turns off a portion of that muscle, and it's to protect the muscle. It's a really, really great system that the body came up with to make sure that we don't injure it anymore. Helping reconnect those nerves to those muscles through the chiropractic adjustment, facilitated with some neuromuscular reeducation. So we train that connection back to those muscles. After we get the connection, then we start to work hard or strengthen that particular muscle. So it's really essential that we have no scar tissue in it. We have the nervous system connection and communication so that we can strengthen the muscle correctly with full range of motion and function.
Adam, I know this is going to be an easy question for you, but I want to really ask this question because I know there's so many people out there who have different concerns or fears about seeing a chiropractor, which is they're so far behind the eight ball. But for those people who do have concerns, can you address those that people just don't know about what chiropractors do?
Sure. The chiropractic treatment in and of itself is inherently very safe. The incidence of us causing any kind of injury or worsening any injuries is very, very, very small. A few cases a year where we have some kind of injury out of millions of adjustments. And most of the time, that's just a misinterpretation of exam findings or x-rays. Making sure that we have all the necessary information to create the most appropriate treatment for you is essential. So making sure that you find a chiropractor that does take x-rays, does do exams, is really a good way to make sure that you don't have any of those potential issues, but it's extremely rare that we have any kind of complications with the chiropractic treatment.
I've noticed that there's a lot of people who've been joining our show in the middle. I think this is really an important question that, again, tell people what the risks are, especially in personal injury, if left untreated.
If we don't get soft tissue injuries treated, so namely car accidents, even that mild ache or pain is going to eventually break down the soft tissue, break down the disc and everything connected to it and cause what's called osteoarthritis. That osteoarthritis is considered a progressive degenerative disease, which means it's just going to get worse unless you do something about it. And eventually, that's going to lead to surgical intervention, numbness, tingling, dysfunction, loss of function of hands, feet, all kinds of horrible things that come from it. So early treatment is essential in any of those soft tissue injury cases.
Brooke in Allen, Texas. Steve O, really enjoying the show. Could you please ask your guest what causes a stiff neck and how do you treat it?
For sure. If we have a stiff neck that came out of nowhere, likely we had a soft tissue injury many years ago that was mild, very mild. So maybe you jarred your neck when you tripped over a curb or something like that. Or we have a really bad posture. So we're always working on a computer for long hours and our head's really far forward of our shoulders. By the time we cause irritation between the joint spaces, that's typically where we're going to get the very stiff neck. I can't turn it as far. I can't rotate it as far. I feel pinching or pain when I do go backwards or sideways. That's telling us that we have that subluxation complex or that bone that's stuck out of place. Generally, a series of treatments that correlates to the x-rays will be able to unstiffen that particular neck. Normal stretches where you're trying to touch your ear to your shoulder, doing circles, as long as those aren't painful, that's definitely a good way that you can start to alleviate those symptoms. If it's persistent, so we say that it lasts more than 72 hours, that tells us that something more than just a muscle ache is there, and we should get that checked out.
Someone just wrote, where's your office at?
We're located at 411 North Washington, the Big Baylor University Hospital complex here near downtown Dallas.
Oh, okay. So, and it's called Texas Functional Health Centers. The phone number is 469-334-0624. If you're watching on YouTube, we've been running that. But for all of you listening on iHeart and Spotify, again, the phone number is 469-334-0624. Adam, I love the way you answer questions. You don't talk over people's heads, and people I can see that people just feel so safe with you treating them, and we really appreciate you.
Thank you for having me.
Thanks so much, Adam, and that'll be it for us today. Again, it was someone just asked me again, Texas Functional Health Centers, 469-334-0624. The website is www.texasf as in Frank, H as in Harry, C as in Charlie.com. That's it for us today. We'll be back in with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.